What we're going to be talking about this afternoon is a home blood pressure monitoring program. And this is a program that's being sponsored by Blue Care Network. Why am I bringing this to you? One, because I developed the program. Two, because I developed it so that it was an advantage for you. And they are allowing me to give you free medicine for high blood pressure for 2 years. Okay? I know that currently what you do is you have what's called a copay if you're a Blue Care Network member, and you have to pay a certain amount for your medications, but we pay the majority of the cost. So what's going to happen is that not only will we pay the majority of the cost, but you will have no copay. Your copays will be waived for 2 years as long as you're with the program. And the other part that's advantageous for you is that, one, you will have to have your own computer because we will provide for you a free blood pressure cuff so that you will be checking your own blood pressures at home. What the literature states right now is that what happens when we check our own blood pressures at home, we have better control of our blood pressures. I want to encourage you, remember I said to you to write that number down downstairs, 140/90. The reason why I want you to write that down is because when your physician says to you, oh, we got your blood pressure today, and yours to say, doc, what was it? Because oftentimes you probably don't even think about, well, if the doctor said it was okay, then it's okay, so I don't need to know what it is. But I want you to start to know your numbers. So what you'll say is, well, doc, what was it? And they'll say, oh, it was just 158/90. Say, doc, what about 140 over less than 90? Okay? Why can't we get it down to there? For some of us, it's very difficult to get the blood pressure down, but the importance of getting it down is, one, you want to decrease your chances of having a stroke. You want to decrease your chances of having a heart attack. You want to decrease your chances of having heart failure. And heart failure is just what it sounds like, when the heart doesn't pump as well to sustain life. Heart failure. Okay? So, the program objective is to determine the effectiveness of a unique approach, and I refer to it as a unique approach. They tell me in this company that sometimes I get a little bit radical, but yes, I do, and I am, because my background is from practicing medicine. I do administrative work now, but I also still practice medicine as I did last evening. But so some of my ideas might be a little bit more radical than those people who are physicians who are accustomed to now sitting behind a desk and just moving some papers. Okay, so they first thought, oh, that's real radical, Logan. I said, well, but still. And at the time when I checked the literature, there were no programs. The programs that were out there in the studies and all just had programs that lasted for a year. So for that reason, I chose 2 years. But after I made that decision, then literature came out, and they talked about a program that's been going on now for about 8 to 9 years. The company called Kaiser Permanente. Well, they're usually on the West Coast. They're in the West. And their advantage over the offices that you go to for your primary care physician is that they not only have the offices, but they're also an insurance company who has the offices. So they have an advantage that other companies, other primary care physicians do not have. So I presented this and thinking, well, if I can prove this, if it can work, then maybe they will expand it. They will expand it to all of the membership. And that is what they're considering. But I have to make sure that it works. The literature says it works, and we should be able to do this in 6 months. But I'm going to go for 2 years. So you're still going to get blood pressure medications that are free for 2 years as long as you stay in the program. So what we're trying to do is you'll see on this slide it says 100 members. We actually expanded that because we know that people drop out. So we actually expanded it to 150. But within those members, we need African Americans. Now we always talk about All the literature, we talk about what's in the literature, but oftentimes it really doesn't apply to us because oftentimes it didn't include us. Or if it did include us, the numbers were so small, they were insignificant findings. So with this particular program, we want half of the participants. Now, am I going to shun any persons who want to participate if I already have my 75 African Americans and I get up to 100, up to 125? No. I'm going to say, well, those were participants and they wanted to participate, and I've already sent them the blood pressure cuffs out to their physicians' offices, and they qualify because they're Blue Care Network commercial members, and we would also take that. So it's first come, first serve. Now, you'll see on this slide too, number 4. Well, number 3 says you have to have a computer. And you have to have a computer because we're going to provide a blood pressure cuff for you. The blood pressure cuff is by a company called Omron. It's one of their best cuffs. And I actually negotiated the cost of this, and they couldn't believe that they went down in the cost, but they did. So that also tells me that I'm not really sure how much that blood pressure cuff was worth, but it's their best blood pressure cuff. And you'll have the ability to take that blood pressure cuff, and it is easy to use, by the way, connect it to a USB port or cord to your computer, and your blood pressures as you take them will be uploaded into the system. You will send them to us at Blue Care Network. You'll be sending them to a pharmacist. Now, every pharmacist is not a PhD pharmacist. We have a PhD pharmacist that you'll be sending them to, and they will be in touch with you as an individual. They will not only work with you with the medication, you will let them know how the medications are working. Your blood pressures will tell us how the medications are working, and we'll also work with you with lifestyle adjustments or changes. Now, why are those important? Those are important because in the literature it says that if you can make those adjustments, you can actually decrease your chances of a heart attack or a stroke in a significant manner, just with lifestyle changes. So with the medications and the lifestyle changes, that's a win-win. Member must be an active commercial, as I told you before, Blue Care Network member, or have that particular coverage. Now, the program overview, you'll see Blue Care Network and your primary care physician will collaborate, and we asked the physicians to submit participants. I've not really gotten a good response from that. Yes, I have to admit, when I wasn't talking to the choir, I perhaps was talking to those people who weren't that interested, but they all were on board when I came up with this idea. This just wasn't an idea that I came up with on yesterday. It's an idea that we've been working with for over a year now. I have presented it to them. They are physicians. I am the only person of color in the room. And so when I presented this, they were all in agreement. They all said, oh, that's a great idea. Yeah, we think that is. That's good. That's good. And now the participants or the physicians who are on the bandwagon and providing participants to us, one, and that is a physician out of the Kalamazoo area. Now, are we saying that none of our members are seen? Well, I don't know, but I did take a look. I took a look at a part of our program, which is called Healthy Blue Living. Healthy Blue Living is a program of which I am also a member of because I also participate in that program, and that is the way then we as an insurance company can take a look at the blood pressure to see who has high blood pressure, to see what the pressures are. I took a look at that list and I went down real deep on that list because I wanted to know, well, what is the representation here? How many African Americans do we have on here? Guess what? Very few of us sign up for Healthy Blue Living. So I was a little bit disappointed with that, but I know we're out there. I know we have high blood pressure. I know some of us are Blue Care Network members. So what you will need to do is say to your doctor, I'm a Blue Care Network member, and I see you told me my blood pressure wasn't at 140/90. You told me the number was higher. So I want to get on this program. Now remember, you're going to get a free cuff, and your medications are going to be free for 2 years. Now those copays may not be significant, but if you take a look at them over 2 years, that can maybe get you a nice piece of jewelry or whatever. But, okay, it may be worth something to you. We will be training the members on how to use the cuff. The cuff is real easy to use. It's very easy to use. Now, the member activities. First thing you do is you'll be taking your blood pressure every day. Why are you going to do that? You're going to do that for 2 weeks. We need to get an idea of what your blood pressure looks like. Because remember, we've not been really providing your care for you, so we don't know what your blood pressure looks like. We'll also be looking at the medical information that your physician has and will be providing for us, but we need to get a feel for what your blood pressure looks like. Only for 2 weeks will you need to check your blood pressure every day, morning and evening. After that time, you'll be checking it only 3 times a week, Monday, Wednesday, and Friday, and that will be an AM and a PM. Try to get that at the same time of day because throughout the day, the blood pressure will vary. Now, there's something that I shared with someone, and it was in regards to some new recommendations. The new recommendations are in regards to blood pressures. And the recommendations say if you're 60 years old or older, you can tolerate the higher number being 150 rather than 140. These are relatively new recommendations, and I think that it's going to make some of the physicians see that as, oh, okay, I don't have to really get on this blood pressure that well. You know, I can just go ahead and let it float up a little bit and everything is okay because that's consistent with the new recommendations. I say to you that as African Americans, your blood pressures don't go down. My blood pressure doesn't go down at night like other people do. Okay? And this is in the literature. This is the real story. Our blood pressure doesn't go down at night. So when we start out in the morning, our blood pressures are already higher than everybody else's. Can't really tell you why that happens, but it does. So therefore, we know that for us, we need a 140 if our heads can tolerate it. If we're not getting lightheaded when we get up from a seated position, if we're not getting lightheaded when we sit up from lying down, then we need a 140 or less. Why do we need it? We want our kidneys to be happy. You want to keep your kidneys. Kidney disease goes along with high blood pressure. Most of the people who are on dialysis are there because of either diabetes or high blood pressure. So you don't want to go there. Now, blood pressure information is uploaded as I shared with you, and we would ask that you adhere to the prescription and the monitoring recommendations. So certainly if it's making your head feel a little bit woozy, then you send a note. You send a note to Dr. Cook, who is our pharmacist, our PharmD, our doctorate of pharmacy, and say to him, this medication is making my head woozy, okay? And he will respond to you. We will make adjustments in that. Therefore, you'll still see your doctor as you normally do, but you will not have to go to see your doctor just because your head is woozy, because just think, when can you call your doctor and say, you know that medicine you started me on made my head woozy. Do you need to see me today? The doctor will say, well, what was your blood pressure? If you didn't have a cuff, how can you say what your blood pressure was? And then, when are you going to be able to get in? Will they take you on that same day that you called them? Probably not, okay? So, again, this places us at an advantage with this type of program. Now, the pharmacist will collect clinical pertinent information. We talked about that. We'll email the nurse at the physician's office. So your physician will always know what we're doing. Your physician will be not left out. That was a very important part of all of this because we as physicians get our egos going, as you know. And especially if we're male, I'm female, but especially if we have those strong male egos where I don't want anybody doing anything with my patients because I'm in control. I'm the captain of my own ship. Well, yeah, so what? You put your pants on just like I do. But for that, I would say it's a team. So your doctor will be included in the process. They will know all the recommendations that we make. So there will be nothing there the doctor is not aware of, except now your blood pressure is getting under control. Now, in the literature too, I'll share with you why the blood pressure usually isn't under control, because the physicians oftentimes are not as aggressive as what they could be. They may tell you that your pressure is okay. It makes it a little bit easier for them because they don't have to worry about adjusting the medication or trying to add another medication to it. And I do say, we as African Americans, we have higher blood pressures to control. We do. Now, the pharmacist will always also review any medication changes with the member by phone. So whatever we make, whatever recommendations, you're always included in the process. You will know exactly what will be there. The pharmacist will contact the member if the blood pressures are not being transmitted appropriately, or if you're forgetting to take your blood pressures. They'll give you a call and say, is something happening? We're not getting your blood pressures. You say, well, my electricity went off and it's not working. Okay, so, but let us know. Let us know what the problem is. Okay, and if we need to, we also have case management at Blue Care Network. So if you need extra help with that, we also have that available. There's a lot of things there with the insurance company that I found out since I joined them that are available that I really didn't know was available, and I want us to start using them. This is one of the reasons why I took the job, because I always feel as though we're always there when the crumbs fall off the table. Okay, we're always there to see the result of it. We're not there when somebody's making those decisions about what should happen for people like us. So that's why I'm there. So I'm oftentimes a fly on the wall. I'm oftentimes, I pull that elephant out and I call it an elephant when the elephant is in the middle of the room and everybody's trying to inch around it. So sometimes they say things about me, but that's okay. That's okay, because I advocate for us, because I know that if I don't advocate for us, nobody else is going to. Now, that's it. That's the program. 2 years, no copays, free blood pressure cuff, control of your blood pressure to decrease your chances of a stroke, a heart attack, heart failure, and kidney disease. That sounds wonderful to me. Thank you very much for your time. Do we have any questions? Any questions at all? Yes.
How did you say we go about initiating, getting involved in this?
Okay, there is a phone number, and what I'm going to do is I'm going to give you that phone number as we sent that information to one of my colleagues. If you were at the Celebration of Soul, there was a souvenir booklet. And in that souvenir booklet, we actually have a flyer. There should have been some of these flyers downstairs too on that table. Who got their blood pressures taken? Were there any flyers down there regarding this particular program? It was probably blue and white. Yes? No? They're in the package. Okay, the flyers are in your package, and there's information on there with a phone number. Where exactly are they in the package, please, so that we can let them know? There it is right there. Thank you. This is the flyer. The phone number is on there. Okay? Give them a call. Remember, you have to be a Blue Care Network commercial member. Blue Care Network commercial member. I would love an opportunity to provide you with an advantage over others. Okay? Thank you. Any further questions? The ladies are still downstairs until 1 to take your blood pressures, but they are leaving at 1 o'clock. It's 1 now, so they're probably gone. Yes?
Question, if you're already taking a blood pressure medicine, would you, and it seems to be working, would you have to switch to go on the program to?
If your blood pressure is already working, if the medication is already working and your higher number is less than 140, then you would not qualify for the program. We're only taking those who have problems with their blood pressures, but we can't take you if you already have kidney disease, and we cannot accept you if you have had a recent hospitalization due to blood pressure problems. Okay?
What is considered recent?
Recent. Within the last 6 months. Okay? Yes.
Why is it that there's consistently a problem with African Americans dealing with blood pressure? Is there something else besides poor health? Could it be diet, and could it be related to our genetic historical heritage from the continent?
Okay, well, think about that. Think about when we were on the continent, when our ancestors were on the continent, it was very, very hot there. So, of course, they probably took in a lot of salt, because what happens when you take in a lot of salt? Water follows it. But they actually worked and they did a lot in the weather. Okay, so they needed the extra salt. They needed the extra fluid. Well, now, let's go back to the United States. So they brought us over, and then we were in slavery, and we worked the fields. Okay, we built this country. But again, we still needed salt, because that was hard work, and we still needed some water. Now, are we still working the fields? We paying other people to come mow our lawns, so we're not even mowing our own lawns, okay? And we pay a membership at a health club to go exercise. So certain things didn't change. Certain things remain the same. Now, there is some genetic relationship, and the majority of the people who have high blood pressure, it's referred to as essential hypertension or essential high blood pressure. That's 95% of high blood pressure. There's only 5% that has reversible causes. So the majority of us have essential hypertension, if we have it, and we need to do something about it because it's lifetime. It's life term. Now, remember, if you're taking your medication, you still have the diagnosis of high blood pressure, and some people have said, well, since I'm taking the medication, I don't have high blood pressure anymore, so now I can stop taking it. Nope, that wrong answer. Okay, your pressure is under control because you're taking your medications. So you need to continue to take your medications, even though you still have your diagnosis of high blood pressure, but your pressure is now under control. All right? All right, very good. Thank you.